Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What is deep brain stimulation?
Deep brain stimulation, or DBS, is a surgical procedure to treat certain movement disorders, such as Parkinson's disease, essential tremor, or dystonia in select cases. It involves a brain surgery that implants an electrode into the brain to deliver electrical stimulation that alleviates symptoms. And it's been approved for about 20 years, and actually over 100,000 patients worldwide have had DBS surgery.
What type of surgery is required for this treatment?
The first step to the surgery for DBS is to place a frame around the scalp, and that helps to guide the surgeon to the correct location inside the brain. Then an electrode is placed through a small hole in the scalp about the size of a nickel, and the electrode is placed into the target group of cells that we know alleviates the symptoms. So once the electrode is in place, a test stimulation will be performed to assess symptomatic benefit and side effects. And this might involve actually awakening the patient from anesthesia during the surgery. Once the optimal target placement is confirmed, the scalp will be closed and a wire will connect from the scalp to a pacemaker-like device that's implanted under the skin of the chest. And after this, the surgical portion of the procedure is complete, and the stimulator can be turned on to start to deliver the therapeutic benefit.
What patients benefit from deep brain stimulation?
Select patients with either Parkinson's disease, essential tremor, or dystonia could be surgical candidates. The surgery is not right for everyone, so it actually involves a multidisciplinary and multiple step procedure to be evaluated to see if a patient may be a good candidate for DBS. The surgical candidate selection is very individualized. For example, a patient who's considering the surgery comes in to meet with a movement disorder specialist from our team, undergoes a comprehensive evaluation and neurological examination. They may then be assessed off their medications. So we may ask that they actually come in after not having taken medications overnight to assess their baseline symptoms. We'll then ask them to take their typical dose of medications in our clinic and evaluate the response. This is important because in Parkinson's disease specifically, we know that certain symptoms that respond well to medications also respond well to DBS, and others that don't respond well to medications may not improve after DBS. So it's really important in setting up the correct expectations for the patient about what the benefits of surgery might be as well. After this, we refer patients for neuropsychological testing and an MRI scan of the brain, and finally a consultation with our neurosurgeon. And after all of this data is complete, the DBS team meets at a conference to discuss each individual patient. We review all of the results from all of our evaluations and discuss the risks and benefits of DBS surgery for that patient. And the patient is then informed about the results of this DBS conference, and a mutual decision about whether or not to proceed with the DBS surgery is only made at that point.
What happens after the surgery, and how often do patients come in for checkups?
After surgery, we adjust the dose of electricity just like we would adjust the dose of a medication. Through the programming procedure, your movement disorder specialist gradually adjusts the parameters of the electrical stimulation to target your individual symptoms. And this process can take time. So for instance, after the DBS is placed, a patient may come every 2 to 4 weeks to the movement disorder specialist in the beginning few months, and after that every month or so. And it's not unusual for a programming process to take about 6 to 12 months to really optimize the programming for that patient. After that, there are routine check-ins to evaluate the battery and that the system is intact, and they're much less frequent over time. Various patients could benefit from deep brain stimulation. If you're a patient with Parkinson's disease, essential tremor, or dystonia taking medications but are unsatisfied with your level of symptom control, it's worth discussing DBS surgery with your neurologist and considering asking for a referral.
If I think deep brain stimulation might be right for me or my patient, what happens next?
The first step is to ask for a consultation at the Movement Disorder Center at UMass Memorial. You'll meet one of our movement disorder specialists to get you started in the process and learn about the procedure as you meet the whole team of neuropsychology and neurosurgery and neurology.